Hello, Namaste. I'm Ramya and I invite you all to this webinar on behalf of the ICCW team. Happy to meet you all once again on this platform. COVID-19 has caused a severe disruption in routine healthcare services all over, more so in developing and low-income countries. In the light of the current situation, ICCW reaffirms its commitment to its goal, that is clean water for all. Water is the medium for hygiene as well as most of the diseases. How do we work around clean water and hygiene from an environmental, biotechnological, medical, and public health perspective, individualized as well as holistic? Let us learn from the erudite speakers and panel members in the symposium. I now invite Professor Pradeep to deliver the welcome address. Professor Pradeep.
Welcome to this webinar and third symposium of the series on a theme of enormous importance to our planet, our only home. Good morning, good afternoon, good evening, wherever you are. The topic of today's discussion is disinfection and hygiene, best practices. Water, disinfection, and hygiene are closely connected. According to the World Health Organization, hygiene refers to conditions and practices that help to maintain health and prevent the spread of diseases. This country not only knew, but also practiced this definition for over 3,000 years. Let us realize that this region promoted daily bathing as a ritual. It was important to take bath before the daily worship. Before cooking, especially as part of festivities, in my parental home, bathing was essential. After coming home, the first thing to do after work outside was to take a shower. It was important to wipe the floor at home every day. It was essential to clean the neighborhood. We all ensured that water bodies were safe. We built the first cities with elaborate systems for transporting waste. We protected water sources, and it was considered the duty of everyone to maintain temple tanks and sacred groves. Fecal sludge management in villages used to be efficient. Somewhere along our course of development, we lost that goodness and filth started accumulating our neighborhood. And all that we were concerned about was our own dwelling, and our filth became neighbors' responsibility. But as you will see in the course of presentations, villagers knew for long how to manage themselves. We did have a detailed understanding of hygiene and health. Our Ayurvedic text that I used to read, Ashtanga Hridayam, talked about personal hygiene. It went on to purity in mind and not only body for sustained health. In a water-stressed world, sustainable disinfection and hygiene face a number of challenges. Let me not dwell into them for want of time. In today's symposium, we have about 424 strong network of thought leaders and future leaders. Right now, we expect to have 600 plus people as we go on. We have exceptionally talented speakers and excellent panelists. In fact, the best we can assemble. They range from finest technologists to a champion of grassroots innovation. Academia, industry, incubation, and organizations are represented. With all of them together, we have over 100 man-years of dedicated work in the area. I will keep this talk short as I would like to have time to take as many questions as possible, especially from the young. The conference is organized by ICCW, the International Center for Clean Water. It's an initiative of IIT Madras to ensure that the world is water secure. ICCW is a place where anyone can come and build a water technology from scratch and implement it in the field. It's a place where water technology is built here and at other places can be implemented in the field. It's a place to train water technologists of tomorrow. As you all know, water is chemistry, it's physics, it's biology, it's agriculture, it's engineering, health, biodiversity, incubation, whatnot. Therefore, ICCW is an interdisciplinary center. Please visit us if you come to Chennai or visit us virtually. This symposium series was inaugurated on May 7, 2020 by Mr. Parameswaran Iyer, Secretary of the Ministry of Drinking Water and Sanitation. At its peak, we had more than 670 participants in the first symposium. That symposium was put together in just 4 days, and I was excited to see the thunderous reception. Last week, we had 570 participants for the second symposium. Now we have 470 or so. For the benefit of all, we have kept a live streaming of this event in YouTube so that more people can participate in it. Please enjoy your time with productive engagement. Thank you.
I now invite Dr. Bruce Rittman to deliver the first talk of the evening. He is Regents Professor of Environmental Engineering and Director of the Biodesign Svete Center for Environmental Biotechnology at Arizona State University. His research focuses on the science and engineering needed to manage microbial communities to provide services to society. Services include generating renewable energy, cleaning water and soil, and improving human health. Over to you, Professor.
Not yet. It's a little delay here in doing this. So while we're waiting for the screen to transfer to me, I'll say good afternoon or good evening to you. It's 5 a.m. here in Arizona. Thank you for inviting me. All right. Let's see.
Yeah.
It still says use my keyboard. Let's see.
So you're
Nothing
on.
is happening. Yeah. Okay, seems to be working. Yay. Okay, so I'm going to talk about emerging environmental biotechnologies for treating organic waste streams. And let me see if I can make this work here. Okay. All right. So today, all around the world, we use conventional wastewater treatment, but my story to you today is that this is obsolete. So here is a graphic of what we do today for wastewater treatment. On the left side, you have some sedimentation that's very efficient and good, but then in the green part, you see activated sludge. This has been used for more than 100 years around the world. It works very well. It removes organic material and nitrogen and many other things. So it in the sense of working, it's okay, but okay, but it has a big problem. It's very expensive to construct, and even more so, it's very expensive to operate here. So therefore, it's really not a sustainable technology in the developing world, and consequently it either never gets built or it gets built and it is not operated properly. It leads to environmental damage, public health risks, and the most important thing today is lost resources, particularly all the energy that is in the wastewater. So, oh, by the way, this is not true only for the developing world. This is actually true for everyone. And so it's not just one. What I'm proposing here and going to talk briefly about today is what I'm showing here, a dual anaerobic approach. And it's going to have two parts. On the right-hand side, we're in with the blue. It's an anaerobic biofilm membrane bioreactor. It's direct anaerobic treatment of wastewater. And then at the bottom, we're going to see anaerobic digestion of sludge, but we're going to add food waste. So we're going to deal with a second organic stream in the water. So let's start with the first one here. And that is the anaerobic biofilm membrane bioreactor, or AMBFMBR. And so we're going to stop aerating. We're going to stop putting oxygen into the wastewater for treatment. And we're going to use two features here. We're going to make it completely anaerobic. We're going to have inside the anaerobic reactive biofilm carriers. These are just small solids in which biofilms, the bacteria attach themselves and are retained. And then we're going to have to the right a membrane for perfect separation of all solids. This allows us to have many advantages in wastewater treatment here. This has been tested at a fairly large scale and in several ways, but I'm going to talk about my favorite one. It's called the Staged Anaerobic Fluidized MBR, or SAF-MBR, developed by Professors McCarty and Bay. And it's a two-stage process. On the left side, you have a fluidized bed of granular activated carbon. You look way to the right, you can see what granular activated carbon looks like. Microorganisms attached to this. These are the anaerobic methane generating microorganisms. The water from the first stage moves to the second stage, where you have more of this granular activated carbon with biofilm. But you can see there's a membrane in here which provides perfect filtration so that you get a really high quality effluent. So I wrote a paper published in Nature a few years ago about this, in which we integrated this two-stage process that's shown here on the left side, where you can see the methane coming out, with some downstream processing that I won't talk about today. And the key thing that I want to talk about this is that we did a cost estimate, cost benefit analysis on this, and that's shown on the next slide here. And so on the right-hand side is traditional activated sludge treatment. And you can see there's a lot of big bars down to the bottom below zero. This is cost. So that's about $4.7 million per year operating cost for about 100,000 cubic meters per day of treatment. On the left side, you can see what we have when we use what we call the resource factory that includes this anaerobic biofilm reactor. And you can see there's a lot of bars above the line. So this system is a net income generating process. The pluses are much greater than the minuses here. So we can convert the huge expense of wastewater treatment into a cost benefit, a source of income for the community. Now, I'm going to come back now to the other part here that's at the bottom of my diagram. That's anaerobic digestion. Now, we use anaerobic digestion around the world for treating sludges from wastewater treatment. So that's not new in any way. What is new is the addition of food waste or other organic waste materials from the food system into the anaerobic digester. And so more than 50% of the solid waste that we have in urban communities is organic food waste. And so we can remove about 50% of the waste stream from the solid waste, divert it from the landfills, add it into the anaerobic digester, and produce a lot more methane, which is, of course, renewable energy. And we can double or triple the output of methane here on this. Now, when I did my, I've been working on this topic more recently, and I don't have a beautiful picture of the cost-benefit analysis, so I adapted the one I had before by adding a big bar here, a big black bar here. So if you take what I talked about before with the anaerobic biofilm membrane bioreactor, and you add to it the anaerobic digester with the co-digestion, now you get this giant big black bar up here into the plus region. So now you can turn wastewater treatment into a really large source of income, as well as, of course, renewable energy for the community. So that's my basic story here today. The idea is we want to make organic waste, whether it's in the wastewater or whether it's in the solid waste, we want to make it a generator of renewable energy and monetary benefit. This will make us protecting the environment and protecting the public health cost effective, in fact, very advantageous from an economic sense. And with that, I believe I have come to the end. Yeah, I have some extra pages, but this is my main story. With that, I'll stop talking and thank you very much.
Good evening to all of you. I want to begin with a small story, 2,000-year-old story, which tells us as to what the heritage of this country is about water. How have we conserved water? How did we develop the consciousness to conserve water? Because unless you have accessibility, affordability, and availability of water, how would you have hygiene? How would you have sanitation? So all the three dimensions were perceived a very long time ago. So once a teacher asked his student to bring a glass of water. The student went and brought a glass of water. Teacher took the water and gave the glass to the student. The student went and kept it in the kitchen. Teacher called him back. What did you do? Sir, you asked me for a glass of water. I brought the glass of water. You took the water, you gave me the empty glass, and I went back and kept it in the kitchen. No, tell me, what did you do? He repeated the question. The student would repeat the answer, and after a while, his student says, I now know what did I do. So tell me, what did you do? You asked me for a glass of water. I brought the glass of water. You took the water. And then you gave me the empty glass. While going back, I threw just a few drops on the ground. Now, the moment he said just a few drops, he got his end. 2,000 years ago, there was no shortage of water. For next 1990 years, maybe there was not going to be any shortage of water. Why is this teacher developing a value about conserving even a drop of water? Because he anticipated the problem that we're having today would be realized at that time. So therefore, there is a strong need for us to realize that there is a huge tradition, very long tradition in this country. But somehow over the period of time, that tradition has been weakened. Pradeep mentioned in his introductory remarks that how his family and his culture and his community had wonderful traditions of using water very judiciously and with great care. Now, if that is the case, then how do we learn from the people, common people, children, about the way water should be made available, affordable, accessible? And what are the policy issues that we need to understand? First of all, let me make it very clear that there are three major challenges that have affected us in the field of sanitation. One, we designed toilets all over the country, which was a very desirable mood, very appreciable mood, but they all were designed with the assumption that 15 liters of water is available to wash it up, to drain it. We don't have water for drinking. In many parts of the country, only 40 liters per capita is available. How can they use 50 liters just to drain for one person the toilet? They couldn't have. So naturally, we needed to design different kinds of toilet for different kinds of regions, depending upon the availability of water, depending upon the soil conditions, depending upon the drainage condition. There's an opportunity now. So many migrants have gone back to their villages. Large number of them have gone from construction industry. And I would appeal Pradeep to take this issue up at the national level. We should work together to make this issue an urgent issue. If under the Mahatma Gandhi National Rural Employment Guarantee Program, we make rooftop water harvesting a compulsion in every single school and public building, every single school and public building. And we have a skilled manpower in villages. We don't have to bring them outside. They have built huge buildings in which I and you live. They have built multi-story building, 25-story building, 50-story building. So naturally they have the skill. They have the know-how. And Finance Minister has recently announced 40,000 crore package for NREGS, National Rural Employment Guarantee Scheme. So funds are available. What is required is a linkage of these funds, skills, and water. So we must not lose this historic opportunity of using this opportunity that the COVID has offered to us, despite all the pain that we are going through. Never again we might find, and I wish we never have again, a situation when so many skilled people will have to go back in the manner that they have gone. We could have been much more compassionate. So that is first issue. Second, we can also make underground storage structures to prevent evaporation. In the hot tropical climate, of course, water storage is a very deep major issue. So rooftop harvesting with the underground storage structure will be a step forward that we should take. This second challenge that is very critical is how do we develop the culture of using water judiciously? And I will show you some slides. Can I change them myself? No. Yeah, now look at this picture, which is very painful. And what is the solution that came out? Next, please. Chaya Thakur, a student of class 7, I invited her to my institute for teaching my students about how these simple problems can be solved. For 70 years, we have inertia. We have, in our Shodhyatras, learning walk, we stayed in school. I saw this problem. It never occurred to me as to how the little kids and the taller kids will take water. She said, just tilt the pipe, just tilt the pipe. The smaller kids will drink water from here, the taller here, taller here. Availability, accessibility, and affordability. Very simple, but all the three are required to be merged into a single design. This girl, I invited her as a visiting faculty to IIM Ahmedabad because she saw a problem, she found a solution, and she got it implemented in her school. She had autonomy and agency. Autonomy is freedom to take decision. Agency is willingness to use that freedom. She had both. Next, please. This is a painful situation. You know, many places, this is how women have to take water. We have seen that in our Shodhyatras, open wells. Obviously, this can change. Next, please. This has to change. Now look at this. A simple 400 rupees solution. Normally, one hand pump, one child can drink. I'm showing you how accessibility can be increased. Now, with one pipe and distributor, 6 taps are there. One child will pump the water, one boy, 6 kids can drink water at the same time, cost hardly 400 rupees. You wouldn't find even 4 schools, unfortunately, in which such a system has been installed. Our inertia, our indifference, our ability to live with problem unsolved indefinitely. These are the 3 major barriers that we have to cross and provide solutions. Children must get access to the water. If obviously if they have to wash hands, they need to have many taps. And this obviously will provide better answer than what would be if there was only one hand pump providing water. Next, please. Now look at this. In Mizoram, we were walking in Shodhyatra. There was a one drop by drop dripping from this tap. The washer was not so good. So what did this person do? He put a channel and put a canister here. He was conserving every drop of water. I saluted that person. I said, look, I respect what you have done. You have given a message to all Shodhyatris that every drop counts. These are small steps, but this can make a big difference. Next, please. Next, please. Next.
Yeah, there is some delay. There's some delay.
Yeah, okay. Just go back. Go back. Now look at these kids in Meghalaya. What are they trying to do? They were playing and they made a simple device to transport water. Now I don't want our children to do work, but if they can convert their fun, their joy into a task, so it be. And next, please. Next, please. There is a dam that has been made, the semicircular dam. Next slide, you will see that. And I mean, Pradeep would know better that the pressure of the water when it comes, if you have a straight line dam, then they tend to get damaged more. This is much better. This was developed by Bhanji Bhai Mathukia from Junagadh district, Bisavdar place. And please go ahead. Premji Bhai replicated that. It has been replicated in other parts of the country. Next, please. So there are small innovations that are happening. Now I want to talk about this, which is a very interesting innovation. You know, we want to conserve water, but we want to conserve water also by conserving soil. And to conserve soil, you need to have plantation. And how do you ensure that in an arid region, less than 500 millimeter water, a tree can survive with 1 liter water in its entire lifetime, 1 liter water once. So Sundaramji from Sikar has developed this technology. He would not plant trees during the monsoon season. He will plow the land in the monsoon season. Before monsoon season, the water will go down. After the monsoon season, in month of September, October, he will do laddering, plowing and laddering, so that capillaries will be broken. Water which is underground will remain in underground. Then open a very small pit, 6 inches wide and 6 inches, 6-inch diameter and a foot deep, just enough to put the seedling there. Normally we dig a trench of 1 foot by 1 foot. The whole water which was there underground in the subsurface water. Yes, in this case, this 1 liter water given once, why does 1 liter water suffice? Because would not send the roots on the surface where the
Professor, can we just hold on for a minute?
Yeah.
Yeah, there's a lag, so we are having overlapping of your sound. So maybe you can start now. Yeah.
Somebody has switched on the mic, so they should switch off the mic, then it will not happen. Echo comes because, yeah, no, it will not come. Pradeep, your mic, yes, no, it will not happen. It's okay now? The mic was echoing. No,
I can hear you very well.
Okay. So the point is that if you give too much of water to the plant has no need to send roots deeper. It will leave it on the surface where the water is. In this case, there is no surface water available, no surface moisture available in the month of October. Moisture is available only downwards. So plant is forced to send the root downward, and these roots capture the next monsoon. A terrific example. Next, please. Next, please. These are the result of that kind of plantation. 85% rate survival. Next, please. Next, please. Now, this is the last, and I wanted to show you this example. Aquatic weed is a very major problem in Andhra Pradesh, in Hyderabad. Nasimha has developed a very simple device by which he pulls all the weeds out of the lake. He has cleaned several lakes, and then we told this information to our High Commissioner in Kenya, Mrs. The lady who was in charge at the time, and she got it imported in Kenya. So in Kenya, we have got now this machine exported from India in Victoria Lake, is cleaning devices for aquatic weed. So let me summarize what I have said. The first is there's an extraordinary opportunity that COVID has provided us for using the skills and the knowledge of the knowledge economically migrants, poor migrant who have gone to the rural areas, and their skills can be used for conservation, for rekindling the conservation culture, for making the rooftop water harvesting structures in every single school of the country, more than 1 million schools, and there must be underground water tank in every school. So all the tropical, all the places which are where water shortage there, and 3/4 of the country has water shortage, should have water. This water will make sanitation possible. You will be able to clean the drains. The toilet that we misdesigned will now be clean because there's water. Otherwise, they will remain stuck, as most of the schools in many parts of the country, we find that. Second thing, that we must also try to use the skills of these people for cleaning the drainage and for making sure that the weeds don't grow in the irrigation channels and other things. Third is, how do we use these traditions that we have in our country of innovation and try to kindle the spirit of conservation through collaboration and creativity and compassion. Thank you so much.
I think I had covered this. Next one.
Yeah.
This also I had covered. Okay. Insofar as India is concerned, the guidelines and recommendations for COVID-19 are available in National Center for Disease Control. I just want to put up so that those who would like to see what is being in fact recommended by Government of India are there. The next slide, please. Okay. Guideline for home-based care is given in that particular website document. What I wanted to show you is, though it is at number 6, avoid handshaking and wash hands frequently in soap and water. In fact, washing hands with soap and water has become a very important aspect insofar as the cutting of the transmission of this particular virus is concerned. The next slide, please. I have taken, in fact, those who would like to see what is WHO recommending, most of the documents are there in this particular website. In fact, number 120 is the document that is now running. The next slide. Okay. The WHO in fact says that wash your hands. It is not just for COVID. Okay, it in fact protects from many other diseases. Coughing, sneezing, caring for sick, during and after preparation of food, before eating, after toilet use, when hands are visibly dirty after handling animals, protecting others from getting sick and protecting others from getting sick. These are few recommendations which are actually very common. Here, clean hands with alcohol-based rub or soap and water. Actually, I would recommend use of soap and water, but then it becomes difficult in places where so water may not be available, including soap. So alcohol-based hand rub will probably become the one. Next slide, please. And very detailed information about water, sanitation, and hygiene. This is known as WASH by WHO and UNICEF. The next slide, please. Okay, access to sanitation and clean water is an important thing. Okay, it is seen that running water are most likely to engage, those who have running water, they're most likely to engage in hand washing. And the geographic and location of the household is expected to be correlated with different access to clean water and sanitation. Next one. Next one, sir. Okay, this I think I have covered. Next one, please. I think this is the next one, please. Okay, what WHO recommends is there are guidelines. In brief, the number and size of the hand hygiene stations that needs to be adopted. I think people can go through this particular document and then see. Next one. We all know that there are ideal hand hygiene materials are water and soap. In fact, some use ash and mud if it can be ensured that it is free of fecal contamination. It is not recommended now because it is not clear whether we will be able to do that. And water alone. Okay. And then, of course, we need to use piped water supply. If we are using refillable reservoir or clean, then probably we will have to dispose the cleaned water, it's known as grey water, in a way that it will not, in fact, cause harm or others. Alcohol-based hand dispensers are also used. The next one. Pardon, sir?
We need to move on.
Yes, sir. I think I will move on now. Next. Next. Okay. See, no, go back. This is the last slide. Expectation is that piped water supply in all rural areas probably may not be, it may have to come anyway. 24/7 safe water supply in all public private areas and availability of detergents. Again, this probably will be a too high an expectation. If we are able to, in fact, ensure that there will be drastic reduction in not just COVID, but in all respiratory and diarrheal diseases. In fact, there are many reports which have come, which have shown that after the lockdown was implemented, there has been a reduction in the number of diarrheal diseases in Bangalore. It is difficult to say at this moment what was the actual cause for these reduction in the diarrheal diseases. There are many other diseases that, in fact, can be prevented with a good application of water insofar as the public health is concerned. Thank you very much, sir. Thank you. Sorry, my sincere apologies for not able to connect earlier. Thank you.
A very good afternoon, good morning, and good evening to all the participants. And I would like to take 10 minutes from now, and I would like to speak on the on-site sanitation issues and fecal sludge management, which directly relates to availability and non-availability of water, both because it contaminates the access to water. Some previous speakers have touched upon this thing, and there are challenges as well as there are some best practices which can show us the way forward during COVID as well as beyond COVID. So water problems will remain and sanitation problems will remain. And thanks for Ramya to agree to assist me with slide changes. If you go and go to the next slide, please. If you look at last year, India declared that we have become 100% open defecation free. And in particular, I'll be talking about today the urban sanitation situation. In India, urban situation is that we added 6.3 million toilets in 4,324 cities. And we had 5,82,000 community toilets. However, in terms of excreta management, the safe disposal of excreta, which is fecal sludge as well as the sewage, is not happening. And this was the picture in 2011. And then what we did was we later on have done some ground surveys to find out whether the situation has changed with the toilet provisioning, which is largely appearing to be more of giving privacy and comfort, but not reducing the environmental pollution problem. Next, please. A lot of waste was finding its way into the local area in the open drains and receiving waters and contaminating the sources of water supply. This slide shows that excreta continues to be a big problem, and it is unsafely disposed into open areas and water bodies. Ramya, next, can you change the slide? We did a study to cross-check whether the situation had improved, and we did a detailed survey of 66 cities, the Amrut cities, of different class sizes, million plus city, 1 million plus city, and moderate size and small cities. You see that in UP across this, we found that 73% percent of the waste is still being disposed of untreated into the environment, the water environment and land environment. And back, please. Can you just go back? If you see on the right-hand side, the red color shows that the unsafe disposal. At the bottom of this, you will see there are some green patches which are shown, which are the big cities, which had some treatment facilities. However, considerable wastewater and fecal sludge still remains untreated and is disposed of into the open environment. This is the situation of UP, which is 15% of population and land area. Next. And what our surveyors found on the ground was, I think there's nothing on the screen now. Ramya, if you can help me. So the type of containment systems which have come up along with toilets, I'm just showing you this. Some of these pictures will show you. Next, please. This is the type of emptying what happens to these containment systems attached to septic tanks, pits, or other structures. Next. And this is how the emptiers, who are privately, private players, informal sector, which is not even recognized as an essential service in the time of COVID, they take out sometimes waste illegally and just dump into the rivers and water bodies. Next. Next slide, please. And this is across 8,000 urban centers in India. It's a common feature. None of 90% of these desludgers do not have any licenses, are not registered with the local bodies. This is an informal economy. Next, please. You can see how these informal sector operators, they have just a mobile number on their desludging machines pasted, and then there's a long pipe which goes into the high dense areas, slum areas and informal settlements to empty the on-site sanitation system, which have come up along the toilets which have been provided in the urban areas. And after taking out waste from the septic tanks and the pits, either they dispose it off onto the landfills or solid waste dumps, and contaminating the environment. Next. Can you change the slide, please? And these are some more disposal pictures that how at some places they have due to awareness, there has been a permission for them to dump the fecal sludge into the sewage pumping stations. However, in general, across the country, it is disposed of. This is high BOD, ranging between 3,000 to 6,000 mg per liter BOD fecal sludge, which finds into the environment, polluting the water sources. So current sanitation focus has been on building toilets, important and necessary. The previous speaker also said. However, in the name of management, what we do is only we talk about sewage treatment plants, the big hardware approach. And many times we are also now talking about sewage treatment plants, lifting water from open nalas or streams, and then treating the wastewater and disposing of the treated wastewater again back into the polluted stream. this is the current system, what is happening. And this informal sector, which is doing a good sanitation service, is not even recognized. And end result is that there is a lot of pollution which finds it to the the land environment and water environment. Next, please. However, the excreta management, where there is a coexistence of planned settlements and areas which are connected with the sewer network, which is off-site sanitation, as well as on-site sanitation where toilets have been provided, where there is a containment needs to be emptied properly, transported properly, and treated properly, and then put to the use. The water can be reused after treatment, as well as the solids can be used as manure when they are treated, have gone through the treatment in fecal sludge management. So this is the approach which we are trying to say can solve the problem of water and hygiene in urban areas. After the toilet provisioning, we need to focus on this. Next, please. If you see the sanitation value chain from containment to emptying and treatment and disposal, this is called fecal sludge management. And on-site sanitation, we have made provisions for toilets and containment systems. We need to provide for the wastewater and the supernatant flows which comes out from this, these septic tanks, which needs to be channelized and done decentralized wastewater treatment. We should avoid mixing of effluent from the stormwater or tapping it for treatment. We should do treatment at smaller scales. We should avoid direct disposal of untreated effluent. And there have been some cases where we have been involved in advocacy for managing the fecal waste. And I would like to show a short video to show that how some cities are emerging as champion cities in managing on-site sanitation and fecal sludge management. Can we go to the next slide, please? We are providing a support to cities in UP, and there are several other development sector players. They are promoting for fecal sludge treatment. The fecal sludge treatment can be done in two broad approaches. One is the anaerobic-based approach, where you have the separation of solid and liquid, and there is a biodigester where the treatment happens, and there are liquid and solid streams, which is a usual system of treatment of liquid stream and solid stream of the wastewater. Next, please. And there is an aerobic system where basically you end up having some a planted filter, and then where water gets treated. So I just wanted to give an idea about that. There are some towns emerging as champions in fecal sludge management, and showing the way that it is not just that the conventional way of centralized sewage treatment system, which even the big cities like Delhi and Mumbai are failing. That Delhi has been able to provide sewer network to only 65% of its inhabitants. So this clearly shows that there are best practices available and alternate ways of managing on-site sanitation systems, as well as fecal sludge management is offering a hope for addressing the issues of water and hygiene. And during COVID and post-COVID, access to water and safe water is a big issue. So these things will become important, and we should promote these kind of examples, best management practices. So CSC has done documentation of such case studies of on-site systems, fecal sludge treatment, and decentralized wastewater treatment. Ramya, if you can go to the next slide. I would like that all the participants, they should spend some time. Next, please. One more slide, next. This is a web-based portal called Menu of Unnetworked Technologies. Over here, you could search for such kind of best management practices for on-site sanitation system, fecal sludge treatment, decentralized wastewater treatment. These case studies and best management practices can be searched technology-wise, cost-wise, and geographical location-wise. So this will help the practitioners and policymakers to understand that there are some successfully implemented projects which can show the way, and the water and hygiene in small and medium towns could also be improved, including the big cities which are struggling to achieve sustainable sanitation for all. Thank you very much. With this, I will stop here. Thanks, Dr. Pradeep, for giving me a chance to speak here.
Great. Good day to everyone from joining from the various parts of the world, and thank you, Dr. Pradeep and ICCW, for organizing this event. My topic is a little off from all the eminent speakers in the panel. I'm looking at touching the people aspect or the human aspect of bringing in change in hygiene and discipline. Every time when we set up new protocols or new decisions as part of an organization, we generally ignore the human aspect, and that's where we see that most of these new protocols fail. And for the factories that are reopening and many organizations and schools that would be reopening post-COVID, educating someone on why something is important would be more important than doing it. So my presentation would touch a little bit upon that. The next slide, please. Brief background about the companies we represent. Megamorph is into the manufacture and marketing of cleaning and disinfection liquids, pretty much the need of the hour today. So we are supplying products like sanitizers and disinfectants to many companies. And the most important aspect we look at is educating them on the usage of it. Depth filtration has been into the manufacture of water filters components like sediment filters and carbon blocks. Now, the process that I would like to talk about is something that we have abbreviated to a project called PRIME. So any new protocol that we would like to implement in anything, we look at implementing it in these 5 phases. P for planning based on the facility, R for rehearsing what is planned, I for implementation, M for monitoring the behavior, and E to educate everyone repeatedly. The next slide, please. So when I say P for planning, it would definitely involve every single employee or employees at different levels in your organization. It is important to bring them together to explain what exactly you propose to do, because everyone has a point of view. Be it the factory manager, the labor supervisor, or your quality manager, everybody has a point of view which they would like to share. Getting everybody on the same plate definitely helps you understand exactly what are the challenges you may face. Along with these people, you would need to study the kind of government guidelines as a group so that you understand what exactly we're looking at implementing, and do a site-specific assessment and audit. Why this becomes important is, for example, something like using of hand sanitizers has been widely proposed by the government. But an industry or a chemistry lab where there are open fires or flames, this can be a very major hazard. So these are things that need to be taken into mind when you're looking at guidelines. And when the government issues guidelines, we need to remember that they're guidelines and they need to be formulated specific to your site. Once you brainstorm on the effective ways of hygiene and discipline, we need to look at action points that need to be concretely done by each and every member in the team. Assign them individual responsibilities and then go to the next phase. Next slide, please. The next would be the rehearsal. So doing a mock drill of an action point. Any change, be it something related to COVID or not, it would be very advisable that you look at doing a mock drill of any change that you want to establish in a currently running system. Because you would come across problems, constraints, and hurdles that would only come about when you practically implement the change rather than when you discuss about it. Identifying risks of fire and safety is a very crucial aspect when you look at a manufacturing unit. You also need to assess the modification of your protocol based on the rehearsal and highlight possible non-compliances with your leaders. Next. And always implement change in small incremental steps. The Japanese policy of Kaizen, which is adopted by many organizations, is about small incremental changes, which is how the human mind would be readily acceptable to these changes. Highlight the implemented changes with signages, markings in appropriate languages that everybody understands. And the implementation of any new measure should not affect the productivity. Any change that you would be doing should not really affect what they would already be giving as an output of a production. Next. Monitoring, again, is an important aspect of any change. Keeping measurable, quantifiable goals and reviewing them with your leaders is very important. Issuing a warning on non-compliance and rewarding people who successfully implement it would be something that would keep them motivated to continue doing this. The next slide, please. This, I would say, is the most important step about any change. Any change that you wish to bring about in people, instead of just telling them that this is the change, please go to that, it would be important that you educate them why you are doing this change. Why is it important to wash your hands? Why is it important to use a hand sanitizer? Why are we disinfecting the floor with, say, sodium hypochlorite solution? Why is it important to save water when you're washing your hands? All of these are things that you need to educate and remove this fear which is around this disease, which is predominantly affecting all our lives. Once the fear is eliminated, they are more open to understand exactly why we are doing this and encourage a positive, healthy working environment. The next slide, please. Here, I want to share a couple of best practices that we are following at our units, which should be specific and quantifiable and measurable. So when we manufacture water filters, which we make the sediment yarn filters, the initial filters that we used to make used to have a need for flushing before they're installed into a water purification unit. A simple innovation in the yarn saves us almost 4.8 million liters per year by making them zero flush filters. So these filters are ready to use as soon as they're installed into a water purifier, and the first drop is pure without any additives, any foaming or any of that sort. So that is a huge innovation that helps you save on water conservation. Using low foaming surfactants in the disinfection that you do, something that was touched upon in the previous seminar as well, is something that would significantly change the amount of water that you use. And again, this is where the education aspect comes in, because foaming is something that's related to cleaning. So people think that if it doesn't foam, it's not cleaning well. But once you educate them, they're more than happy to do it. Having a zero discharge facility basically means recycling of every drop of water that is being used in your facility, and making sure that all of them are being reused for one purpose or the other. So for example, when we have wash water out of a certain process, it can be used as a flush water for the tanks and things like that. So developing that when you are at the greenfield stage itself would help manufacturing facilities adopt very good water practices. Rainwater harvesting is something some of the speakers touched upon. So at our unit, we have about a 1 acre shed, which we have done 100% rainwater harvesting for. During the monsoon months, we are 100% dependent only on the rainfall that we get. And that suffices all of our requirements for production. The next slide, please. These are some of the hygiene and safety practices that we have now adopted in the COVID era, where you do 100% thermal screening, use of hands-free sanitizer stations. These are part of the guidelines, but the way that it's implemented is keeping prime in mind. So once you have those kind of things established, it becomes a practice where the workers now know that they have to go wash their hands every 2 hours. And it's not something that they need to be reminded of. It's something that they do as a practice. The next slide.
So I request you to close.
I'm
shortly.
almost done, yes.
Yeah.
So these are just the pictorial representations of some of the best practices that we do, trying to run the line with social distancing protocols. Next slide. Yeah, so that brings me to the end of my presentation. The last slide is something that we are passionate about as an organization, which is making the world a safer, cleaner, and better place. So with that, I end my presentation and thank Dr. Pradeep and ICCW for this opportunity.
I invite Professor Indumati. She's an expert in groundwater contaminant fate and transport, remediation of contaminated soil, groundwater, and I can go on, but ma'am, here you are.
Yeah, thank you, Ramya. Thank you, Professor Pradeep and ICCW team. I have 3 slides to share so that the participants will have something to take home with them. I would like to present something a little different from what the other speakers have been talking about, and something which not many of us are aware of. The COVID, currently what we are facing, the pandemic and COVID issues are, I would say, as I have described here, is only at the tip of the iceberg. The iceberg being antimicrobial resistance. I will explain that in a moment for people who are not familiar with it. Some of us do in a small context, I think, with respect to illnesses and antibiotic resistance we all face, but it's much bigger than that. Okay? So antimicrobial resistance and the relationship with COVID is what I would like to present in the next 5 minutes. So we have been hearing a lot in the news about COVID deaths, and many of us also follow it. When we follow it keenly, we would know that 50% of COVID deaths, the recent Lancet report says that 50% of COVID deaths is not just because of the virus, but following secondary infection caused by bacteria, bacterial sepsis they call. The lungs and many different parts of the body is being infected by bacteria. And if you go back and look at the Spanish flu pandemic again, 50 million people were dead because of the bacterial infections and not the virus. Okay? And bacterial infections are something which we are all grappling with for a very long time. And in recent times, we know that we are developing a lot of resistance to antibiotics. Whatever be the disease, it can be simple intestinal disease or terrible ones like tuberculosis, malarial deaths, are all happening because of resistance developed to bacteria. And this is not just the resistance caused by improper use of antibiotics, but unknowingly all of us are contributing to the resistance. Next, I will just quickly go talk about antimicrobial resistance and how water engineers have to be worried about it, not just the hospital and the doctors. So one thing we all understand now is how closely everything is interlinked. And with respect to antimicrobial resistance too, if you can see my pointer, when humans are hospitalized or when we take antibiotics, most of the excess antibiotics are released in our waste and eventually it finds its way to a water body. Similarly, when animals are fed with antibiotics, now it has become very common. Preventive antibiotics are dumped in poultry and livestock. Aquaculture is fed with antibiotics. Eventually, most of the antibiotic finds its way to the water. And when it enters a wastewater treatment plant, where what we were just hearing from Professor Rittman, where we grow a lot of bacteria, and most of these bacteria pick up the resistance from the bacteria which is released from the human fecal matter or the animal fecal matter in the environment. And so we are growing resistant bacteria in a wastewater treatment plant and eventually releasing it to the environment, into the water bodies where the wastewater eventually discharges. And that closes the loop. It comes back to us if we don't control it in different ways at different stages. So inherently, all of us are getting exposed to resistant bacteria. And when you're sick and if you take an antibiotic, it's not going to work. This is supposed to be, as WHO calls, the next tsunami in healthcare. So that's why I talked about COVID being the tip of the iceberg. Okay, given the magnitude of the problem, we are getting a lot of resistant bacteria in our environment, in our body, and we don't have antibiotics to deal with them. From 1984, there has been just one antibiotic which has been newly developed, which can cope with resistant bacteria. Not much investment is going on antibiotic development. And with all this, we know there is a cause for concern. There's a reason for concern about AMR. And how do we cope with it? How do we manage with it? The hospitals have to do their bit. The animal husbandry people have to do their bit, as I have listed here. But as water engineers, what is our role and what are we going to do and what we're supposed to do? So there is a lot we could do. There's a lot of scope for research, implementation, legislations. One is developing cost-effective treatment technology for removing the residues of antibiotics which get released. So just the regular treatment technology is not going to help. We need to go for advanced technology. Beyond that, and removing antibiotics, we should also take care of the resistant bacteria which are being released by human bodies and which are growing exponentially in wastewater treatment plants. So novel disinfection strategies are important, just like how we are talking about COVID, disinfecting for COVID. We should also integrate it with disinfection for the antibiotic resistant genetic material which is produced. And there's a lot of scope for new guidelines, monitoring, and particularly when we are reusing the treated wastewater and sludge as manure, there is a scope for transmission of these resistant bacteria. And that's a cause of serious concern. And the other important sources of pharma industry discharges, we hear about it, particularly in the Musi River, which has got a lot of attention. A lot of antibiotics are getting released in the environment, which can cause environmental antibiotic resistance. Well, to conclude, I would say that COVID is a blessing in disguise in multiple ways. Particularly, I'm talking with respect to AMR, health and hygiene. We all have realized now the awareness that has been generated on how interwoven and interconnected is the web of life across the different, not only countries' borders, but also across living species. The fear caused by COVID and the increased awareness of hygiene is all good, and we should extend the same even beyond the COVID pandemic to educate people on AMR and how to deal with it, how to cope with it, and how to control it. Definitely, regulations for wastewater treatment has improved now. People are aware that hospitals and quarantine centers have to be, the waste from these centers have to be confined and treated better, treated in situ before we send it out. So similarly, these things should continue. These good practices should continue post-COVID to take care of the AMR issues, which are going to come up very soon. And there is also, there should be new research on antibiotics, new antibiotics resistant, which can deal with the resistant bacteria. As we are developing the vaccines for COVID, this research should also take off. And last but not the least, we have to relook at wastewater treatment plants, wastewater treatment technologies, water treatment technologies with the emerging issues of antibiotics and antimicrobial resistance. I would like to end the talk here. Thanks.
Thanks, Dr. Ramya and Dr. Pradeep. I heard some very critical and important presentations, one covering the dual anaerobic approach on wastewater treatment and including the food treatment. Another one on water conservation, which is quite interesting in terms of innovative approaches. And public health issues, I could not fully hear it because of the audio issues, but I think, seeing the slides, there were a lot of important things that were coming in from there. And Suresh talked about the fecal sludge management, how things are happening, what all are the best practices, and then prime and innovations, and also finally the antimicrobial resistance issues. So in the water and hygiene best practices, what I would like to discuss is about equity in water hygiene and health in this current context. So while living with COVID, we are going to live with COVID for some more time. So in that situation across the world, there is a very strong realization that is coming up around the importance of water hygiene and health. The connectivity of this, and also the need of co-living of water hygiene and health, that realization is there. And WASH has been recognized, water sanitation and hygiene has been, the sector has been recognized more than ever. And I would start with, when you talk about the best practices, there is a recent experience that we had about running a hygiene campaign across the country when this COVID challenge was starting. All the program locations of water agents. So we developed some open access hygiene material because the lockdown and related challenges. One of the issues that we thought was that we need to develop something that can use the new media of WhatsApp or whatever those kinds of things. So audio, video, and digital poster, those kinds of things. We ran a very important campaign on hygiene. While running that campaign, some strong realization came in. Those strong realizations are having very important connections with the topic that we are discussing now. One is that I was going through this, the school WASH guideline. It's called Swachh Vidyalaya guideline of India. There are international participants also, so probably in other countries the guidelines can be different. So if anyone has to add 2 times hand washing during the 8 hours of time students are studying, so the additional water that is needed is 3 liters per capita per day. So during COVID, if we have to add the hand washing practices for more than 2 times, say 4 times, then that means at least 5 liter per capita per day water needs to be added in the daily kind of water quota that is coming. So how to do that? That is a big challenge. So here, we need to think about various ways of addressing the water crisis. Another area, antimicrobial resistance, was touched upon. Very importantly told as the tip of the iceberg. But importantly, where is it coming from? One of the source, not all sources, one of the sources, the biomedical waste, how it is managed and how it is getting mixed with water and all that. Other infection sources, the resistance is also coming from how our health facilities are managed. So since I'm coming from a public health background and was head of State Health Resource Center in one of the Indian states before, I've seen how our healthcare facilities are located and how resource constrained are the primary healthcare facilities that we have. And particularly in urban areas and also in rural and remote or tribal areas, how difficult it is to maintain the standards in terms of water, sanitation, hygiene in healthcare facilities. And now in this COVID situation, when hand hygiene of not only the community and people, it is also important, not only during COVID, even otherwise, hand hygiene of healthcare providers is extremely important and very much important, and how the water, sanitation, hygiene facilities can be provided, how standards could be maintained, how protocols could be put in place or implemented. We have, in various countries, WHO has put up protocols, and in India, we have kind of Kaya Kalp guideline or Swachh Swasth Sarvatra guidelines, or, we have even Indian public health standards are available. How these standards can be translated into reality is an issue. For that, important component is, how to ensure. Hand hygiene of healthcare providers and infection prevention and control, how to do that. Similarly, some other institutions like schools and child care facilities, like in India we call it Anganwadi centers, creche facilities. So those facilities, when they are opening up, how to ensure water and hygiene facilities in those settings is another critical challenge. And I'll come to the critical area of slums or informal urban settlements where the urban poor are. So we have in front of us the experience of Dharavi in Mumbai. And also, so I recently wrote an article in Indian Express wherein, we have tried to address the specific water crisis, sanitation crisis and hygiene crisis in this slum locations, and how governments and urban local bodies can do something on this. What are the innovations that is possible in these locations? And so that is something that so overcrowding and chaos while tanker-based water supply is happening. How can you bring in innovations like, some collection tanks could be placed in the slum locations, and then you can have multiple water taps connected to that so that people can, yeah, definitely. I'm closing. And then about quarantine facilities and how to do with water stressed area, all that maintaining hygiene using less water and to sustain the hygiene behaviors. How can we do that? These kinds of questions are something that we need to take forward and find answers for. Thank you.
So when we have been hearing about several best practices on fecal sludge management, STPs and so on, very important perspective of industry best practices also very much to be taken into attention. And fortunately, in this country, we have been doing very good work in terms of Indian industry, which they have been setting benchmarks for the international organizations also on the water management practices, particularly towards the water conservation front and maintaining the sewage treatment plants, effluent treatment plants, and the quality of wastewater that is generated out of these plants. And to our best knowledge, we have seen organizations, increasing their potential of recycled reuse to the extent of 65 to 70%. We have been hearing that zero liquid discharge is a very big, initiative, but zero liquid discharge, again, to all of us, we should think in a different way that how much is the percentage that we have done towards zero liquid discharge rather than 100% zero liquid discharge. So all these efforts of international benchmarks and the national benchmarks which our own organizations have, attained, it's very, very heartwarming in terms of how India is progressing. And one thing which I learned during this COVID lockdown, which professor has been, asking, what did you do? What did you learn in this COVID lockdown? What I learned, I would say in a moment is, everyone came together to fight this pandemic, and we were almost successful in taking this fight against this pandemic. Similarly, I think we should think of working together to do a very good initiative towards sustaining our water resources on in several ways and means, and for which we have very good best practices available across the country, and it is for anyone to adopt it and get the benefit out of it. Last but not the least, industry has excellent capacities to do a very good initiative in terms of best practices, and we have a very good demography, as we have been seeing all over the country for the last several decades. The capacity building is very, very important. Capacity building, training and skill development is very important, and particularly towards the O&M, operation and maintenance of several of these equipments in terms of their performances and things like that, will lead to a huge contribution towards achieving several things in terms of water, sanitation and hygiene. So I will not take much time. I don't have much time to continue on this. I request Ramya to probably take it to the next speaker.
It has been I think it is my slot now on the question and answers. Correct? Ramya, you got disconnected.
Yes, sir. Yes, sir. I'm here. And we have fantastic list of questions.
Lots of very interesting ideas came up. I'm extremely sorry that this got somewhat delayed. I wanted to take 15 minutes of your time for question and answers. It will get delayed to 7:17 or so, but then it is important to take those questions. I understand that India, the lockdown period now, it is 7 a.m. to 7 p.m. people can work. And I am sitting at IIT Madras and I need to step out. I hope that I will be permitted to go home. But then risking that, we will take some questions. While I'm sort of presenting these questions to the speakers and the panelists, I would like certain people who have asked interesting questions to come as panelists. And I'm asking my colleagues to bring Professor Sandhya Rani. I would like Professor Dr. Debel Dev and Dr. Sandhya Srivastava to be on the panel. I would also like to have Dr. Smita Esmule from BARC also to come online on the panel, and we will take these 4 questions. Before I hand over the mic to people in this sequence, Debel Dev, Sandhya Rani and Sandhya Srivastava and Smita Mule, 4 people in that order. Before that, let me ask one question that came up to Bruce Richman. The first, I'm sort of combining 3 questions. Can you put Bruce Richman on the microphone on? So questions are that how much of methane is generated really? And anaerobic treatment, can you treat nitrate and phosphate as well? And what would be the capital cost? Is it really implementable in developing nations? While these questions are asked, I will probably go through other questions as well. Go ahead, Professor Richman. Okay, good. Thank you. Yeah, so let's talk about these questions. First of all, I'll sort of work upwards from the bottom. The capital cost for this anaerobic system is roughly the same as it would be if you were doing a conventional treatment with activated sludge. So there's not a huge change in capital costs. The big benefit is in the operating costs. The next question is about removing nitrate and phosphate. These processes, the anaerobic membrane bioreactor does not remove phosphorus or nitrogen, and I consider that a big benefit because we don't want to remove these valuable nutrients. We want to reuse them. So if you're in an agricultural area, you can reuse the water for irrigation, you get the benefit of the nutrients. If you're not in that kind of a setting,
then there are technologies for recovering the nutrients and returning them to the agricultural system. So the fact that it does not remove the nutrients is, in my opinion, a benefit. And then methane generation. Methane generation is proportional to the BOD, biochemical oxygen demand that's in the water. And for example, that's why adding food waste into the anaerobic digester is so beneficial, because we generate a lot of food waste that has a very high BOD. It tremendously augments the amount of methane produced compared to what's normally in the wastewater. And I think I've addressed all the questions.
Professor Bruce Reitman, very nice. There are very many questions to Professor Anil Kumar Gupta, but let me ask one question. By proposing this rainwater harvesting in places like this that you mentioned and underground storage, are we going to increase a whole lot of capital expenditure, and how can the schools and institutions afford that is a question that came up. Professor.
40,000 crores under NREGS provided by the finance minister 3 days ago for this program is quite a lot of money to accomplish this in much less, a fraction of this amount actually. So this is a goal which will serve our children well for all time to come and will improve the sanitation like no other method can in the short term. So I would suggest that under the employment guarantee program, this activity is taken up on the top priority for the sake of our children, for the sake of our sanitation of our schools, and for the toilet system to work and hygiene and sanitation to work. So there is no need for capital requirement by the schools. It will be met, material and labor cost will be met by the National Rural Employment Guarantee Scheme.
Thank you very much. It was, of course, there are other questions as well, and please stay on. There is a question, Dr. Suresh, and this is particularly in the context of this CapEx cost. You mentioned, according to the question, 6 kiloliters per day STP, the cost is mentioned as 2.1 crore and 27 lakhs per year of operation costs. Is it a sort of exaggerate, or is it too high? And what are your inputs? That's the question.
I think it's not a sewage treatment plant, it's a fecal sludge treatment plant. In sewage treatment plants, you handle a BOD of 150 or 200, which is a domestic sewage. Over here, it's the waste coming from septic tanks, where BOD is 3,000 to 6,000. So the quantum of reduction of BOD, what happens, and the processes which are involved in this are little different from STP in that process, the percentage of reduction in BOD. So it is little higher side, but yes, it also provides a lot of, you can say, way forward in terms of protecting our human settlements and water sources from contamination. And I think even these small towns have been able to finance from their own resources, actually. That has been found. Is
there a possibility of cost reduction?
There are possibilities of cost reduction, certainly. And when the engineers put together the mine, I'm sure that they can cut on the cost, locally available material. But this was the first of the projects. But I think there is a range between 1.2 to 2 crore, which I have seen. The first FSTP in Bangalore was constructed in Devanahalli for around 1 crore only. And this is 2 crore. It also varies from place to place. And so the type of strata you get it's a rocky strata in Jhansi. So the rocky backgrounds, a lot of cost is required for digging and all those stuff. So it is also site-specific things. The cost capex is dependent on what kind of site you get it for intervention over there.
Very nice. Yeah, very nice, Dr. Suresh. And let me move on. And the question now, I would like Debel Dev to come online and then ask his question. Debel Dev is also known as the rice man of the country. Can you speak, Debel? Debel, we are not. Debel, are you? Can you speak?
We seem to have lost him. He's there on the panel, but
Okay, well, all right. So in that
Maybe
case,
we can go to Smita Muley.
no, Santhya Srivastava.
Okay, she's there.
Yes. Santhya.
Yes.
Santhya is speaking from Mumbai.
So I was quite in sync with what Dr. Indumati spoke, because that is the point that I had also touched when I was talking. The only thing is the difference was that you talked a lot about the antibiotic resistance, and my concern was more with respect to the disinfectants that are being used and how they are going to impact the environment. So we are on the right track of thinking, and we need to really work on this aspect far more deeply as compared to what we are working on.
Dr. Srivastava, you don't have a question. I mean, you are reaffirming that this particular aspect is extremely important for the country.
Yes, yes, yes.
Very nice. And can we have Dr. Smita Muley?
Yes. Yes.
Can you speak? Can you ask your question?
Yeah, basically, as you know, I am from Bhabha Atomic Research Center and head of Akruti Technology. My question was to Mr. Suresh Ruhila, that whether the CSC is already having some mechanism, like BRC has a mechanism of transferring technology and promoting entrepreneurs. So whatever research is being carried out, whether it is going to the private industry's hands, do they offer any consultancy or something like that?
Very important point, Dr. Suresh.
We don't do consultancy. However, we have a school of water and waste whereby we develop capacities and skill building with these technologies which we are experimenting and we have implemented successfully. So we have a community of practice of around 5,000 people, I can say, that who work with us, and whatever these new FSTPs planning and designing and decentralized wastewater systems, we have a team of competent experts in our staff. We also have a help desk which provides us every Friday afternoons by appointment over phone, as well as by emails, as well as in person by appointment if people want to come down. However, CSC is not into the culture of doing consultancies, I would say.
Thank you very much. Can Santhya Rani, can you ask your question? The question that I may ask on behalf of him to Professor Anil Gupta is that what can we do to protect sacred groves and traditional or water storage systems that we have in these times?
I would say that I had done a study a long time ago on the growth or construction in the sacred groves in states of our country, and I can see a few sites in Kerala, most sacred groves have constricted in size. That means they have lost the area under sacred grove has been encroached upon, sometime by the communities, sometime by individuals. It has gone down. I'm in Rajasthan.
Come online. Can you speak now?
Yes, yes, I can.
Yes, go ahead, please.
Now I probably must miss the first part of the question. The first part was that how can we conserve the sacred groves? Is that the question?
In this, particularly in these times of COVID and related infections that are coming up, and and areas are shrinking, and people are utilizing increasingly more and more water, more and more disinfectants are coming in.
Yes. Many of the sacred groves are the sources of fresh water in many areas. In fact, the majority of the rivers in the south, entire South India, all the rivers are originating from sacred groves. Brahmani, Baitarani, Odisha, Narmada, Godavari, every single river has originated from the mountain forests. They're not from the the ice caps, but entirely from the sacred groves, and that's why they are considered sacred and the pilgrimage sites. Unfortunately, with modernization, we consider them, and people are now considering them as superstitions. So almost every sources of these, the water sources are becoming polluted with plastics and all kinds of, chemicals, food litters and all of these. So I think first of all, this not to ensure the flow of this fresh water from the origin of all these rivers, we have to reinstate those kind of traditions, not necessarily by religious terms, but at least by conscientizing people that this is so important and they are genuinely sacred. Whatever religion you believe or not believe, you have to maintain the sanctity for the security of the water for every generation to come, and for all the people living downstream, including your own families. That's the conscientization that we need to ensure and emphasize in every culture.
Thank you.
Second is that even in the places where many indigenous societies like the Dongria Kond people with whom I'm working and living in South Odisha, they are maintaining these uphill streams, all the hill streams, and they keep it sanctity, the sanctity of this water by different kinds of traditional systems of use. So one system is that they make sure that they use this water for washing themselves, but they never ever wash their body under the belt, below the belt, because they believe that that will pollute the water for all the people downstream. So all the people downstream still get this water potable. They still use the drinking water, this stream water as drinking water, because it's not used for bathing, especially with this, the body part, any part of the body below the belt.
We will move on. We will move on. Yeah.
So that's why, this is the custom. Unfortunately, we see that over the last few decades, all these customs are being violated and ridiculed by institutionally educated people, including conservationists, saying that we have to liberate them, we have to educate them, we have to enlighten them. And in the process, all these customary mode of use of these resources, including water and the sacred groves, are demolished. And on the one hand, this is cultural assault. On the other hand, there is a physical assault of destroying the sacred groves along with the forest, entire forest, by industry like Vedanta Company. So
thank you, Double Dev.
Just one point of information I want to share with you.
Yes.
This last week, in the guise of this COVID protection, in the Kalahandi district, Kalahandi side of the Niyamgiri Hills, for 2 days, 2 village sites were evacuated. The tribals were evacuated by the industry and police for occupation by Vedanta Company. And that included 2 sacred groves, very old sacred groves, where I documented 3 critically endangered tree species living in that forest. Now it's all cleared. Now, this is something that it's beyond our hands, but this is going on. This is very sad.
Professor Gupta, you have something to comment on?
I would just say what David has said is true, but I am a little more optimistic because after lockdown, people have experienced what nature can be. They have seen stars in the sky. They have heard the sound of the birds in the daytime. They have seen mountains in far regions. So first time, the current young generation has first time experienced pure air, clean sky. So I think if we invest into children and mobilize them, that look, they should put pressure on their parents in support of nature, in support of sacred groves, in support of clean water, clean air. I think there is a hope because these children have never experienced this before. Now they know it is possible. So I think we should develop a mobilizational strategy for children, and that is our future.
On that note, let us close, I suppose, and that's a very optimistic note. Yes. A very important point is that what are the new business opportunities? What are new kinds of things that youngsters can be interested in and take, how can they take this discussion forward to build something new? Of course, Deval has brought up, very, very important concern, and that concern has to be addressed in the larger sense of environment and conservation. Well, there is nothing more that we need to talk about, and let me thank all the people on behalf of ICCW and IIT Madras, and let's meet again next week. Thank you. Bye-bye.
Thank you very much.